Hello. I'm an ex-mental patient and a part-time student in Toronto, and I'm here today to talk about the emergence of crazy students in colleges and universities, psychiatric disability, madness. I'm going to talk a little bit about the challenges that we have as a community in academic settings, and if you want more information, I didn't include it on the PowerPoint, but the website is www.madstudentsociety.com. I'm not going to talk today about something called mentalism or saneism because I don't have time, but I do want to just mention mentalism insofar as mentalism can be equated as the term that people who are mad identified experience that is similar to sexism, homophobia, racism, ageism, ableism. It's sort of the insidious, microaggressive sort of discriminatory, whether attitudes or comments that permeate institutions and society at large. So a word about identity politics and language and labels. Probably a good number of you in the audience are used to hearing people talk about and identify as having a mental illness. And while that's perfectly valid political identity, it's definitely not the label or identity that everyone uses in the MAD community. The MAD community has a variety of identity politics once you're sort of immersed in it. Everything from the word crazy. I identify as crazy a lot in presentations and such. I wouldn't necessarily advocate that you go out and say, you know, hey, you're crazy, I'm crazy too, because depending on where you are, it's not gonna fly. But there are people who politically identify as crazy, politically identify as lunatic. Out in Vancouver, there's an organization called the Lunatic Liberation Front. People identify as insane. People identify as mad. Mad as in madness. People identify as being psychiatric survivors. They feel that they've been not helped by the psychiatric system, but in fact have survived the psychiatric system. People identify as consumers. They're consumers of the services of the system. People identify as consumers of the consumer survivors. They consume the system, but they don't necessarily feel like they're feeling like they're surviving it. Of course, psychiatric disability is the more legalistic term that exists. And there's also inmate. If you're somebody who's been through the psychiatric system for an extended period of time, you will recognize and realize that it is a facility that has locked doors, privileges. You don't get to get out. Lots of people feel like they're an inmate when they're in that system. So some of these identity politics I would also equate with what's happened in the lesbian gay community when the lesbian and gay community have reclaimed the word queer. Is everybody familiar with that? Lesbian, gay, trans folks use the word queer all the time. So in the MAD community, we've reclaimed terminology so that it has less power by those who try to hurt us with that language historically. Just going to skip to that. So the MAD Student Society is a group that I started about 4 years ago because I was in school and I felt very isolated, alone, and I was kind of ticked off at the quality of my academic sort of experience, and I was very politicized, unlike when I was younger and I was going through school and being told what to think. And people started coming out of the woodwork to join MAD Student Society. It's a group that's organized for and run by students who have experienced the psychiatric system. We work to empower and support and mobilize students who are currently or may experience the psychiatric system. We support each other through similar experiences and learn about our history. A lot of people are surprised that we even have a history, that we're not just like individuals who walk around with like diagnostic labels. We've been organizing and mobilizing for many, many, many decades. And we've got a rich culture both locally and internationally. We together in the MAD students, we identify barriers in the education system and address systemic discrimination, because there's lots of that. The MSS holds monthly meetings. Once a month we meet. There's a collective that takes on the advocacy issues, identifies them and takes them on. It's an inter-university colleges organization. And then there's a peer part where we hang out and we talk about what's going on, people's experiences with learning. If they're having problem getting dates because they're crazy, like the range of stuff. What's unique about our group is that we are an alternative to the biological medical perspectives on emotional psychiatric issues. There's zillions and zillions of groups out there that are medically identified for people to get together and talk about their diagnostic label. That's not what we do. People can talk about their diagnostic label, but we're less interested in that and more interested in creating a space to talk and differently about what our experiences are. So what our experiences are of hearing voices or seeing things or having sort of up moods, down moods. How can we talk about that without using medical language? What are different ways that we can talk about that? The group has its foundation in the roots of the history of the psychiatric survivor movement, which has existed since the 60s, well into these days, fighting and mobilizing against the surveillance and medical gaze of the psychiatric system's sort of imposition into people's lives. So what's, how, you know, when I'm talking about the emergence of crazy students, it doesn't mean we didn't exist before. Lots of students were obviously going through college and university before, but obviously not coming out because it wouldn't have been a good thing. And this is a quote from a friend of mine when I asked him, what was it like when you were going to school in the 80s? And he says, back then there was nowhere to turn for support within the school system. So I eventually looked outside the university to other psychiatric survivors. Beginning in 1990, the same year I went public as a PhD student. Before then, I kept it to myself with most people, but started speaking out more after becoming more active. I remember both professors and students making the most disparaging comments about people with a psychiatric history during this period. And that includes people on the left, people on the right, and including TAs in the union. So it cut across all political lines. That would mean even leftist liberal types. I remember references from both teachers and students to people who were referring to people as defectives, and other prof referred to squirrely students. So do you guys think things have changed today? No. This is another quote from a friend of mine who's just talked about a meeting she had with a counselor about some financial stuff. During our discussion, or better to say, during our talk, or better to say discussion, I was told that given how I felt sometimes, meaning sick, depressed, crazy, need ongoing counseling, and given that I'm an international student, meaning I'm not eligible for social health services provided to Canadian citizens, that I shouldn't waste my time, my money. Was I really fit and prepared to be there? Meaning in the university and the graduate school? Could I really handle the requirements of my degree program? Maybe I should consider going back to my country. This is why MAD students exist. But here are some other beefs that we have. Accommodations is a huge challenge for us, probably in the same ways that other marginalized groups are having difficulty with accommodations. There's all kinds of nonsense going on with accommodations from our perspective. Par exemple, you, in some schools, have to not only disclose specifically what your disability is, which is you don't actually necessarily have to do according to the human rights codes, but people asking you if you're on medications, stuff like that. One of the biggest critiques I have is that accommodations office, aside from not being consistent across colleges and universities with respect to standards, every place is doing something different. There's a merging of counseling with rights advice. And my critique is, if you are a student and you need accommodation, you do not necessarily need someone to counsel you. If I'm messed up, I will go see a counselor. I will talk about my emotional problems, about my dog peeing on the floor, whatever it is I need to talk about to get off my chest. That is different than wanting support from my professor who happens to be closed-minded or a bigot or whatever. I'm entitled to my rights advice separate from my counseling. That's not what's happening in some accommodations offices. And I'll get to that stuff, but there's no real evaluation that's happened. Now it's starting to, but historically there's been no evaluation from students about whether or not these offices are working well. Privatized institutions, like those ones that sort of advertise on TV or in the newspaper that are not regulated by the Ministry of Education, are kind of doing whatever they want, and they don't even have accommodations offices. And for our communities, this is a challenge because some people may feel like that they're not able to go to college or university, and then they sort of get attracted to these business like ads that arise, and there's no accommodation or support. Classroom discussions can be a real mess, particularly if you're taking, first of all, if you're taking psychology classes or discussions, or classroom discussions like in social science where madness is taken up. There's all kinds of things that sort of get said that can really actually really be disturbing. And as a student who happens to be psychiatrically identified, you either have to stay quiet and kind of pretend you're not hearing some disparaging remark, or you have to speak out constantly, and then you kind of feel like a leftist, like radical person, like who's constantly raising your hand, right? I expect the prof to be able to address any kind of discriminatory remark the same way perhaps a racism remark would be addressed or a sexist remark would be addressed. That does not happen for madness. There is no analysis about madness in the classroom. Curriculum. All kinds of professors are exploiting and taking up our knowledge and teaching MAD studies without ever consulting the MAD community. This has got to stop. We've got tons and tons of literature out there, but none of it gets incorporated into curriculum. You get a one-sided, usually, kind of perspective, unless you've got a really good prof who's critical. And it doesn't, usually the curriculum does not reflect the diversity of the community. Some of that is changing because some profs are getting in touch and asking MAD people to actually come and speak to the classroom, but not always. So some solutions. Definitely we have to have better standards across universities and colleges to evaluate psychiatric disability practices and what's going on in these offices. I think students should take over as much as possible. I think we should develop alternatives to sort of biomedical stuff and develop the evaluations that need to happen and the questions that need to be asked. Classroom discussions have to be inclusive of the diverse political identities that I mentioned earlier. Counseling and rights advice should be 2 separate offices. Every year, new staff and faculty get trained at every college and university. They need to be talking to us. We need to be educating them and talking about what it's like for us. If you're crazy yourself and you want to start a group, we can do it in partnership. You can start it yourself. Just got to put out posters. Just got to get the word out. Have to know your rights. I really think it's critical. One of the successes of Mad Student Society is that it does have a critical perspective, and that enables people to sort of ask questions. And not everybody wants to be critical, but it's a space where people can ask questions. And dismantling mentalism. I think more of us especially have to help each other in all of our communities to write our stories, tell our stories, research our history, know what other activists have done, and we need to partner up on different occasions. And Mad Pride is one example. There's lots of madness, pride, psychiatric pride days that happen. I do not know why this is not happening in relationship with other disability, why we're not having one giant parade and sort of taking over. Maybe we need to think about that and work together. And that's all I have to say for now. Thank you for listening to me.